All right, how's it going, everybody? Super excited to be uploading my first YouTube video here. We're going to be looking at how to articulate the full mouth rehab. Now, my name is Dr. Derek Gatta. I'm a board certified prosthodontist, and I'll be getting a lot of requests on how to help other providers with articulating full mouth rehab cases when you're preparing all teeth and impressing them all at once. So here we have an individual. You can kind of see and get an appreciation for the attrition and the palatal of the maxillary cast and the facial of the mandibular cast here. And so once this patient agreed to treatment here, we went ahead and did a full mouth wax up, articulated this patient in centric relation, and I opened him about 1 to 2 millimeters in the anterior, just enough so we could have room for our wax up here and restore the vertical dimension. And you can get a look at that from the lateral shots there. And once the patient signs off on the wax up, we go ahead and try this in the mouth using a silicone matrix here. Just use an Integrity or some kind of a bisacryl temporary crown and bridge material to try this in. And at that point, it's a very easy opportunity to have the patient check the mirror, see what they like, what they don't like about their wax up, and we can make changes as needed here. Get a close-up of that. And the patient signed off on what we presented to him. And then at that point, I move forward and I do a bonded composite mock-up in the mouth. That way, when I'm preparing the teeth, I'm preparing them from the ideal shape and form what the final crowns are going to be. And I use a transparent matrix here for that, so you can use a light cure composite to bond that in. And once you have your casts and your impression made, I'm using a Hanna wide view articulator here. Now, when you get to this point, this is where a lot of my friends and colleagues have questions. They're like, all right, well, how exactly did you get to this point? Because you have no stops once you have the whole mouth prepared. So let's break this down here. So to get the maxillary cast on the articulator, I use a face bow, and that allows me to get this cast on the articulator. And now to get the mandibular cast on, I use, so while the patient is still wearing the temporaries in the posterior segments, I take the anterior provisionals off and make a record here, like so. Boom. So now you have, if you can envision this, the patient is wearing temporaries in the posterior and the anterior temporaries are off. That way the posterior is holding the vertical and I have the freedom to make a record here in the anterior. And this is just a Duralay impression or coping here to make a centric relation stop. Now I make my temporaries in sextants, so I'll have temporaries in the posterior, an anterior temporary, and then a posterior temporary on this side. So I have 1, 2, 3 temps in the top, and 1, 2, 3 temporaries in the mandible, splinted. All right, so now this guide here will hold your vertical. Now at this point, you can take your posterior temporaries off, if you can envision that, and you can just do like a blue moose or a Regisil record for your posterior bite. All right. Now, at this point, you also want to cross-articulate your provisional casts, so your lab ceramists have a way to wax up your preps to something. So to get to that point, you want to go ahead and cross-articulate and get a record of your maxillary preps versus your mandibular temporaries. So at this point, I made a new record, again with the same Duralay material, and boom, there we go. So now I'm able to get my mandibular temps on my articulator. And at that point, it's just a matter of getting your maxillary cast on here, because they hand articulate, so that goes on. And there you go. And now you can submit to the lab your cross-articulated provisional cast and prepped cast. And once that is submitted to the lab, you sit back and wait for the finals to come back here. So here is the finished case. We'll get a lateral view of that. facial view. So that's a quick and dirty way of how to articulate your full mouth rehab when you're preparing all your teeth at once using your Duralay record. So if you guys want to learn more about these cases, you can follow me on Instagram and Facebook. Again, Dr. Derek Gatta, looking to help you guys out here. All right, Dental Nation, take care.